our skin is the largest organ of our body, and for us ladies, skin is especially important. To share with us more on that, we are glad to have with us here today Dr. Tan Hiok Hee, a dermatologist and medical director of Thomson Specialist Skin Centre. So Dr. Tan, some of the very common skin conditions that ladies face are, and of course embarrassed by them, include acne, rosacea and eczema. How do us ladies manage it better in our daily lives?
Yes, well, firstly, try to identify the triggers, which sometimes may be easier said than done. For eczema, of course, external factors, including the types of soaps that you use, we generally recommend soap-free or gentle cleansers. Even the duration of your showers, don't take very long showers. Modulate the temperature so that it's not too hot. After a shower, pat dry the skin, don't rub very hard. But one of the key things, of course, is regular use of moisturizers. For some people, it is dusty conditions. For some people, it's even the type or texture of their clothing. So we recommend cotton-based clothing. And I often get asked questions about whether the detergent that they use makes a difference. We generally recommend liquid-based detergents and be very careful about very strongly fragranced products. For acne, there are several triggers, and one of it, of course, is hormonal factors. Many women do tend to notice that the acne flares up around the menstrual cycle. If acne is associated with abnormalities in the menstrual cycle, for example, we sometimes need to exclude other conditions. There's a condition called polycystic ovary syndrome. Rosacea is often triggered by stress, emotional stress, for example. But interestingly enough, some of my patients describe taking very spicy food or very hot beverages as a trigger for the flushing in rosacea.
What are the markers that ladies should look out for when they actually purchase their skincare products?
Usually for acne-prone skin, look for anything that says non-comedogenic. Try to use low fragrance or fragrance-free products. Parabens-free is applicable to some patients, but it's not necessarily something that all patients require. Make sure that you check with your attending doctor as to what other specific agents you should be using or avoiding.
So let's say, a lady with all these conditions, so what are the next steps? What are the options that they have?
For example, in acne, we have a series of potential creams, lotions that patients can use, and when the condition becomes more severe, sometimes we add oral medication. But the thing about acne is that it is not a one-time treatment. So patients are often worried about the initial inflammation of the acne, but as the condition gets better, they then start worrying about the scarring, the redness that follows acne, or even the pigmentation, and these can then be addressed subsequently. When it comes to eczema, which is a chronic condition, it's important to realize that sometimes even with the best care, you do flare up. It could be things that are beyond your control. However, there are important things to look out for. For example, if you experience skin pain or pustules, it could be a complication of eczema. That's when you should see your doctor a bit more urgently, get that acute problem treated, and then get back to your baseline state. But even if eczema is very severe, now in the last 5 to 6 years, there's a whole range of medications that we can use.
And besides that, Dr. Tan, any final words of advice, wisdom for us ladies who are facing these skin conditions? I know that usually we always say enough sleep, enough rest, balanced diet, what else?
Leading a stress-free life, that can be rather difficult, right? But one of the things I would add is avoid smoking. Usually a diet higher in antioxidants has been shown to be useful.
Thank you, Dr. Tan, for being here with us today and sharing with us so much useful information and tips on skincare.